Sedentary behavior, dry eye. Is there a correlation? Let's find out. When I'm treating my dry eye patients, we always try to customize care for their specific needs and situations. So we provide at-home therapies, advanced treatments, but invariably the question that comes up is, what else can I do that can help my dry eye disease? I am always scouring the internet looking for tips, tricks, things that can help my patients. I actually found something in the Ocular Service, a medical journal that I do like to read, and it was the relationship between sedentary behavior and dry eye disease. Before I do that, I want to ask you, what do you think? Is there a relationship between dry eye disease and sedentary behavior? You guessed it, there is. So what they found was the more time we spend sitting, the higher the correlation of dry eye disease. But not only that, the more you were sitting and on a computer, the worse it was. This is not a surprise to us. When we're on screens and computers, we know we like to stare, we don't blink, our eyes feel awful at the end of the day. When you're sitting, that's the breeding ground for inflammation. Chronic low-grade inflammation causes things like high blood pressure, diabetes, and as you can see, dry eye disease. So the moral of this story is, number one, be active. Something as simple as walking is a little thing that you can do that will help your overall health, reduce inflammation, but more than anything, reduce that dry eye disease. In addition, when you're on a screen, you have to take breaks. Remember to blink, use artificial tears as necessary. So those are little things you can do that can help your symptoms and your dry eye. I love talking about dry eye. If you like this video, like, subscribe, ring the bell, leave a comment below. We want to hear from you. We want to answer the questions that you have. We're here to help out. We'll have more videos for you next week.